X-rays. They're such a commonplace thing you practically expect them when you see a doctor. Unless that happens to be Dr. Sean Riley with Tulsa Spine and Rehab. Sean joins us today to explain why X-rays need to be less common. Why is that, Dr. Riley?
Yeah, Charlie. So obviously in my chiropractic training, you learn a great deal about X-rays, how to read X-rays, how to shoot X-rays. X-ray is a valuable diagnostic tool. So I just would like to put that disclaimer out there. I do obviously believe in X-rays, the importance of X-rays, gives us a lot of good information. Many times can rule things out, can tell us what to do, what not to do, more importantly. But I've been practicing 19 years now, and I found it commonplace for most chiropractic offices to, sadly, in my opinion, they're shooting X-rays, for example, on patients before they even evaluate the patient. And I have a problem with that. I have some concern with that, and that how are you able to make a determination of what needs to be done diagnostically if you haven't visited with the patient, you haven't taken a history with the patient, you haven't examined the patient? Because all those types of things are ultimately going to lead you in what needs to be done next. You know, do we need imaging? Do they need a referral? So as I started practicing, I was using a lot of using X-rays for diagnostic purposes to rule things out. And I'd gotten to the point where my exam was typically leading me in the correct place, and that if I felt like my exam indicated or required X-ray, then I would do the X-rays. And if it didn't, then I would feel comfortable not shooting those X-rays on that patient. For instance, let's say, Charlie, you were working in the yard over the weekend. You have no significant history, no red flags, so to speak. You developed a nonspecific low back strain. You present to my office on Monday morning. I do a physical examination. I rule out nasty pathology, a disc herniation. Obviously, I'm not horribly concerned about fracture, dislocation, nothing like that. So it's unlikely that I'm going to shoot X-ray. I can make treatment recommendations on that day and hopefully get you feeling a little bit better. Also, I felt I bear this burden, if you will, that I was thrown in this stigma of, oh, you're that chiropractor, you're going to shoot all these X-rays with me on the first visit. I kind of took that somewhat personal because I have a lot of pride in what we do here at Tulsa Spine and Rehab, and hopefully patients understand that I'm making appropriate recommendations. It's just not a cookie cutter type facility. And so that's why one of the reasons I got rid of my X-ray unit years and years ago. And of course, I still on a daily basis will refer out. I work with radiologists here in town that's able to look at those films with me and give me professional radiological reads. That's what those guys do for a living, to make sure we're not missing anything. And then from there, I'm a big believer in CT and MRI as well. Many times I see a patient, for instance, with radiating pain down into their leg. Once again, I do an evaluation, orthopedic testing, and from that testing, it leads me to believe that they might have a disc problem. Plain film X-ray typically doesn't show us where the disc has gone. It might show me degenerative changes and thinning of a disc space. It will not show me the severity of a disc herniation or a bulge. From there, I would send that patient out for MRI for a proper diagnosis, and from there, we could make the appropriate recommendations. So although I think X-ray is a very vital component of the diagnostic process, I don't think it's necessary to be shooting X-rays on each patient that walks in my door.
It sounds like it has become a crutch for some doctors, or just being done by rote.
Sure. And I can't speak for other physicians, but like I had mentioned, it only makes sense to me. Okay, this is our philosophy here in the clinic, is that it's unable. I find it difficult, or I'm unable to write the appropriate orders or suggestions if I don't know what their issue is.
Sure.
So many times I'll see a cervical patient or a neck patient that's having issues in their neck, and throughout my exam and history, we make the determination there's not an issue with the neck, it's the upper back, the upper thoracic spine. So why shoot all those films prior to me examining the patient? I think I put a lot of emphasis on history in an exam here. That typically leads us where to go.
We're speaking with Dr. Sean Riley with Tulsa Spine and Rehab. It's an integrated clinic providing chiropractic and physical therapy, massage therapy, internal medicine, and yoga. And Dr. Riley, when you're talking about your exam and how it helps you hone in on things, I almost wonder if an X-ray can be misleading, because you could be taken the wrong way, as opposed to, as you're saying, going by the history of the patient and going for the underlying cause of what is causing some of these problems.
You know, like I had mentioned, X-rays should confirm and then start to rule things out, if you will. So I think most physicians or practitioners would agree throughout the history and our examination, we have something called a differential diagnosis. And essentially, when you present to my office and I'm looking over your paperwork and going through your history, there might be 6 things that I'm considering as your diagnosis, what potentially would be your problem. And throughout the exam process, we're trying to rule things out to get it down to 1 or 2 types of things. And with a proper, like I'd mentioned, proper diagnosis leads to proper treatment and outcomes. It's so important that we're diagnosed properly early on. And then from there, we can use these other tools, orthopedic testing, neurological testing, range of motion, possibly x-rays, MRI, CT, EMG, other types of diagnostic testing to rule things out and allow us to kind of hone in on one specific diagnosis that will allow us to treat you properly. I think that the imaging comes from the examination and the history, meaning that those things are going to lead us or tell me what type of further testing to order on a patient.
So to sum it up, you say beware the early x-ray, lean more to the examination.
Sure. I always, patients ask me things to look out for. A little bit of a red flag for me is when you walk into an office, you fill paperwork out, then you're escorted back to an x-ray room before even seeing the physician. That's something that I would look out for, because I think that, like mentioned, the exam, the history, that evaluation is a vital component and will typically lead us on where to go next.
I wonder how many times you see a patient that they think the problem is one thing and the real underlying source is somewhere totally different.
Often, I would say that's more the norm, especially with the internet and access to information. We're all human. We injure our back. First thing we do is we get online and we start Googling things. And don't get me wrong, the internet can be a great place for resources, but at the same time, it can also lead us in the wrong direction. That's why don't replace your physician with the internet. Make sure you go in and get checked out properly, examined and so forth, so they can figure out truly what your problem is.
Being kneecap to kneecap with your doctor, eyeball to eyeball, hands-on, that's the best way you're going to get a reliable diagnosis for anything that's going on with your body. And that's exactly what you can expect when you visit Dr. Riley at Tulsa Spine and Rehab. Dr. Riley, thanks for being with us here today.
Thanks, Charlie.
You can learn more about what you should and shouldn't expect and why at TulsaSpineandRehab.com. And remember also to subscribe to Dr. Riley's weekly newsletters filled with tips and suggestions to help you get moving.